Oh, this is Dr. Jonathan Lai coming to you once again with another educational moment regarding colorectal cancer. So, here I'll be answering some questions that you may have. So, the first one is, what are the common signs and symptoms of colorectal cancer? In general, majority of patients do not have any symptoms. Typically, when symptoms show up, it's typically more advanced disease. However, some of the symptoms include changes in bowel habits, rectal bleeding or blood in the stool, um, abdominal pain, unexpected weight loss, and ongoing fatigue. The other question is, who is most at risk for colon cancer or colorectal cancer? There are several risk factors, some of which are modifiable. That means we can do something about them, and some of which are not modifiable. So the modifiable risk factors include diet. So diets that are high in processed meats, red meats, low fiber, um, and low in um, vitamins. Those diets are associated with an increased risk. Um, Smoking, excessive alcohol intake, lack of exercise, all these are risk factors that we can modify. In addition to these, there are other risk factors such as family history, genetic syndromes, some underlying conditions like inflammatory bowel disease, um, are things that you cannot necessarily modify. And so we call those non-modifiable risk factors. The next question is, how can colorectal cancer be prevented? So, as we've talked about, certain risk factors are modifiable. So, working on those modifiable risk factors like exercise and eating diets that are high in fiber and limiting um, processed meats and processed foods, um, quitting smoking, and moderating alcohol intake are all risk factors that can be modified. The other thing is screening. And as I've mentioned earlier, screening saves lives. So, screening is where you are getting checked before you develop any symptoms. And with screening, you can either prevent cancer by detecting polyps and removing them before they can turn into cancer, or by detecting cancer at earlier stages. And the earlier the cancer is detected, the better the outcomes are. And so, again, I cannot overemphasize the importance of screening. The next question is, what are the screening options for colorectal cancer and how often should they be done? So, the screening options include colonoscopy, which looks at the entire inside of the colon. And um, in that case, we can identify polyps and remove them before they turn into cancer. Or if there's cancer there, we can biopsy them and make the diagnosis. Um, the other options include what we call a flexible sigmoidoscopy, which is similar to the colonoscopy, but does not go all the way to the entire length of the colon. And so that is done every 5 years. The colonoscopy is done every 10 years. There are other stool tests, like the fecal immunohistochemistry test or FIT test, um, or the stool DNA test, which are recommended to be done either annually or every 3 years. There are some blood-based tests that are coming up on the market. They are not quite on the market yet, but they should be available pretty soon, where you could do a blood test to look at cell-free DNA um, as a screening tool. The next question is, why is early detection important? I mean, early detection is extremely important because the earlier we diagnose colon cancer, the better the chances of survival. So, for example, for early stage colon cancer, the 5 year survival is upwards of 91%. What that means is that if you take 100 patients with early stage colorectal cancer, by 5 years, uh, more than 91% or more than 91 of them will still be alive. And so, as opposed to if it's late stage, by 5 years, less than 15% will be alive. And so, it's important to diagnose it early so that we can treat it and have long-term survival. It's important, to understand some of these issues. Sometimes people are afraid to get screened, especially for colonoscopy. However, colonoscopy is a very safe procedure. Um, the worst part of the colonoscopy is the day before when you are taking a cleanse to clean out your colon. During the procedure itself, you are either under anesthesia or under moderate sedation, and you don't necessarily feel anything or remember anything. And so the worst part is the day before when you're doing the cleansing. But once you've done that, you know, if it's normal, you're good for 10 years. And so it's just having one day of discomfort for 10 years of peace of mind. And so it's important to understand that. Um, so again, screening saves lives. We recommend starting screening at age 45 for average risk individuals. Now, if you have high risk, then you will have to start screening earlier than 45. Otherwise, as we say, 45 is the new 50, and screening saves lives. So once you know this, take charge of your life and make sure that you screen. And if you have friends and loved ones who are at screening age and have not done so, encourage them to do so. And until next time, have a blessed day.